Okay, my name is Elena. I am going to be doing a venous puncture today. I've gathered my supplies. I've checked my doctor's orders. I've checked to see why this patient is getting an IV and what his or her age is, what size the patient is, and whatnot. All my supplies are within date, and I've also checked my facilities policies, and I'm within my licensure to do this procedure. So I'm ready now. I go knock on the door, foam in. I introduce myself to the patient. Hi, Mr. Johnson. My name is Elena. I am your student practical nurse today. I'm going to be inserting an IV into you today. What I'm going to do is check his band, have him state his date of birth and full name, and match that against my records that I have with me. I am going to get all my supplies here. I wash my hands. And then I am going to sit down and just take a look at his arm. While I'm talking to him, I'm going to be asking him some questions. Have you ever had a mastectomy, Mr. Johnson? Okay, no. And you've never had a stent or anything put in place? No? Okay, perfect. And are you right or left-handed? Okay, so you're left-handed. Is that okay if I put it in your left hand? Okay. So I am going to be also asking him about allergies. Are you allergic to latex or shellfish or iodine? No allergies to anything? Do you have any allergies to anything at all? Not that you're aware of? Okay. Mr. Johnson has just come in from a motor vehicle accident, and he is a middle-aged gentleman. He's of mid-weight, so I'm going to want to put in probably an 18-gauge catheter in him, but for our purposes today, I'm going to be using a 20-gauge catheter. I get all my supplies ready. He was not in a serious motor vehicle accident, but we want to make sure that he doesn't have any issues going on, so we're going to get all this ready here. And I have my garbage right here. I'm just going to throw everything away right there and wash my hands again. Got all my supplies getting out. Okay, and when I open up my normal saline, I want to break the seal on that by popping it open and getting all the air out, and I'm going to get my catheter ready right now. And what I'm going to do is advance that all the way to the tip. And since both apparatuses were sterile, I did not need to clean in between. Okay, so I've gotten all my things prepared here. I've been I've been talking to the patient the whole time. I have my 2 catheters just in case if I need a second one. I've been talking to my patient the whole time, assuring him that this will be quick and hopefully fairly painless. And also asking him whether or not he's had an IV before, and if he's used to having an IV. He said he's had an IV in the past and is fairly certain about what it's like. Okay. I also have my tape here that I want to get ready. And I'm going to want about 4 pieces. And I want to go ahead and have that ready at the table side. And then also I am going to apply my gloves to my freshly washed hands. And this whole time I'm looking at his arm, checking to see where my best vein is going to be. And I see his hand looks really good. I do see some veins up here, but I'm going to want to start at the most distal part of his extremity, because once I apply an IV up here, I can't move back down. So I want to start at the bottom first and work my way up. I see that he has one in his hand. Is that okay if I place that here in your hand? Okay. So I am going to apply the tourniquet, just like tying a shoe. I want to leave a piece there at the top so I can quickly take it off. And okay, so I see that there. I'm going to want to use that. So what I want to do is I start right in the center. I make my way out, not going over the same spot twice with the same thing. I'm going to wait for this to dry. I'm not going to blow on it or fan it. And then I am going to want to use my betadine and clean in the same fashion, starting in the front, working my way out to the outer edges, cleaning as I go, not going over the same spot twice. And then I want to keep my white tip up, bevel up, and I am going to rub. I would have rubbed this first, obviously, and then rub over that. So I've got a nice clean vein. I've already pre-wiped it, and what I'm going to do is I'm going to go in, and I'm going to go in just far enough until I see a flash of blood. And I've seen the flash. From there, I'm going to go in just a little bit further, just far enough, and then I'm going to advance the catheter. And I'm going to place pressure above that. My 2x2 is here to catch that. I've already got this nice and prepped, so I'm going to apply that in there. And I'm going to fasten it. And then I want to check and make sure. I'm going to open this up and I'm going to flush it. I have gotten all of my air out previously, so I go ahead and flush it, and I see that it flushes nicely. I'm advancing approximately 5 mils of normal saline into there. I open that up. The tourniquet that I had placed 3 to 4 inches above there. I go ahead and close this, seeing as how it flushed so nicely. Remove this, and then I'm going to want to place tape on here. I'm going to clean him up here so I have a nice surface to place the tape on. And I never want to place tape above where the tubing is, because I always want to leave an opening there just in case if I have to replace the tubing. I'm also going to apply my Tegaderm. Prior to applying it though, what I want to do is mark the date, my initials, and the time on the Tegaderm. And I want to do that before I apply it to him so I'm not writing on him. And again, I'm going to place this in a strategic position to where I can still remove the tubing if I need to, but keep the catheter in place. And I want to be able to see the catheter, so I place the writing to the side. And then if I need to, I have other tape here to place this. In a position that is going to be held secure. The whole time that I'm doing this, I'm talking to the patient, reassuring him that the procedure is going well. I'm checking to see how he's reacting to it. The site looks great. I'm looking for redness, swelling, any signs that the IV has occluded or that it's infiltrated, and I don't see any of those signs. He's saying that his arm feels good and relatively good, obviously, since he has an IV, but that he has not, he's not showing any signs of discomfort at all, other than just the fact that he has an IV. So I go ahead and clean up my area. He's good and ready to go. He's saline locked at this point, so he's ready to be taken to surgery if he needs to. What I'm going to do is I am going to, once I'm done cleaning up my area, obviously I'm putting my sharps in the sharp container. Everything else can go in the garbage. I am going to chart date, time, my initials, what the procedure was, why he had to have an IV, where the IV was placed in his left arm or left hand, the size needle I used, and the equipment that I used as far as the tubing and whatnot. I'm also going to assess or chart my assessment of his reaction towards me placing the IV and what the site looked like when I was prior to and when I was done with the procedure. I would get the area cleaned up, get him ready to be sent off, or get him comfortable in his bed and give him his call light and whatnot, open the curtain back up for privacy, or to open that back up, and then wash my hands, and I would make my exit.
Do I push that same button?
Mm-hmm.